The leaves of the aloe vera plant are packed with a soft clear gel, and it's been praised for its hydrating effect and its other medicinal benefits. In fact, past research notes that the aloe vera has been used for centuries by people in Greece, Egypt, India, Mexico, Japan and China for its purported benefits. Hypertension or high blood pressure is a silent killer, according to the American Heart Association. Even though some people don't display any signs or symptoms of the condition, high blood pressure can slowly damage the blood vessels, putting you at risk for a stroke, a heart attack, or other complications. In the past, 90 people with diabetes, who are not dependent on insulin, received either 100 milligrams of aloe vera gel powder or 200 milligrams of the aloe vera gel powder, or no treatment for 3 months. The aloe vera groups also received nutritional counselling. When the researchers evaluated the subjects after 3 and 6 months, they found that the aloe vera powder had helped to reduce the systolic and the diastolic blood pressure of both groups. Researchers posited this may be the result of 2 anti-inflammatory components in the aloe vera, aloamodin and aloin. The past research has shown that these 2 components have anti-inflammatory properties in both rats and in vitro models. More than 30 million people in the US have diabetes, and over 84 million have prediabetes. This is according to data provided by the CDC. Weight loss, a healthy diet, and physical activity help to lower the risk of diabetes and to improve the blood sugar. But there's also evidence suggesting there's a potential benefit of aloe vera on the glycemic control. This was reported in a systematic review of 8 randomized controlled trials published in March 2016 in the Journal of Clinical Pharmacy and Therapeutics. The aloe vera improved the glycemic control in people with prediabetes and type 2 diabetes when it was used as a supplement, administered orally as crushed leaves, juice, a powder or an extract. It lowered the fasting plasma glucose in those with the pre-diabetes, and it significantly improved the A1C in the individuals who were managing their type 2 diabetes. The researchers postulated there was an association due to aloe's ability to reduce the glucose absorption in the gastrointestinal tract and to lower the glucose production, and they encourage further high-quality studies to quantify its effects on the glycemic control. Aloe vera could be an unexpectedly useful addition to oral health. This is due to its anti-plaque and anti-gingivitis properties. A past triple-blind randomized trial allocated 345 subjects into 3 groups of 115 before asking them to rinse their mouth twice a day with a specified mouthwash for 30 days. One group received an aloe vera-based mouthwash. One received a mouthwash containing a popular germicide, chlorhexidine gluconate, and one received a placebo mouthwash of distilled water. After 30 days, the aloe vera-based mouthwash was as effective in reducing gingival bleeding and plaque as the chlorhexidine mouthwash when it was compared with the placebo group. Another previous study found similar results when comparing an aloe vera-based mouthwash with a chlorhexidine mouthwash and a saline water placebo, though this study took place over a shorter period of time. These results suggest that an aloe vera-based mouthwash could be a suitable alternative to traditional mouthwash. Aloe vera gel has been used as an ingredient in skincare products from moisturizers to face masks. This can be credited to the gel's moisturizing and anti-aging properties. Applying a moisturizer is an important step in a beauty regime because it traps water in the skin, helping it to appear more youthful. Dry skin, on the other hand, causes plump skin cells to shrivel, leading to premature wrinkles. Aloe vera has a high number of mucopolysaccharides, a hydrating molecule that keeps moisture in the skin. In a review of prior research, the aloe also activated fibroblasts. These are a type of cell found in connective tissue, and this ramps up the production of collagen and elastin fibers. The results can be tighter looking skin and fewer wrinkles. Aloe vera gel is cooling and it has anti-inflammatory properties, so it immediately provides some relief from discomfort that's associated with a sunburn. A systematic review of 23 studies published in January 2019 in the Iranian Journal of Medical Sciences, found there was a link between aloe vera and the healing of a sunburn. This was postulated to be due to the plant's ability to fight inflammation and the fact that the aloe vera contains glucomannan, a compound that has regenerative properties. The researchers concluded that the plant could potentially reduce wound recovery time, infections, and skin redness. They also noted that the aloe vera gel appeared to be most effective on first and second-degree burns. According to the Skin Cancer Foundation, first-degree burns affect only the outermost layer of the skin, and second-degree burns penetrate into the deeper layers of the skin, causing swelling and blistering. Thanks to its natural anti-inflammatory properties, aloe vera also serves as an excellent acne treatment. Whether it's applied to pimples or to general areas of redness and irritation, the aloe vera has been found to soothe and to diminish the appearance and the prominence of acne and even acne scars. However, aloe vera shouldn't be applied directly to open acne blemishes. According to past research, the aloe vera has the ability to reduce prostaglandin E2 production. Per other scientific literature, these are the lipids that trigger the inflammatory response in the sebaceous gland, which are attached to the hair follicles and produce the oil. The less inflammation in the sebaceous gland, the less the inflammatory acne. Aloe vera gel's anti-inflammatory effects have also been shown to be beneficial in the treatment of psoriasis and eczema. According to the National Psoriasis Association, applying creams that contain 0.5% of aloe vera up to 3 times per day can reduce the redness and the scaling. Yet the NPA note that this is a complementary and integrative treatment, and it's most effective when it's used in conjunction with more traditional psoriasis treatment options. As for eczema, there's a lack of controlled human research on the potential perks of aloe vera. Most of the studies are in animals or people with separate health conditions such as diabetes and gastrointestinal illness. This was noted in a review published in April 2018 in Drugs in Context. Yet those study authors point out that the plant's antibacterial, antifungal and moisturizing properties may also help to prevent flare-ups in people managing from atopic dermatitis, which according to the American Academy of Dermatology is the most common form of eczema. Similarly, an article published on the website of the National Eczema Association suggests anecdotally that aloe vera gel may help to ease eczema flare-ups thanks to its anti-inflammatory properties. Constipation is defined as fewer than 3 bowel movements a week. This is per the Mayo Clinic. But while laxatives, a fiber-rich diet and increased water intake can help to improve bowel irregularity, some evidence also suggests using aloe vera orally could improve the symptoms in patients with IBS and constipation. This is one of the most well-studied benefits of the aloe vera plant. It acts as a natural laxative via 2 mechanisms. It provides hydration with its high water content, and it contains anthraquinones which act as a stimulant laxative. An analysis of 3 studies published in October 2018 in the Journal of Neurogastroenterology and Motility suggest the potential therapeutic benefits of the aloe vera for constipation predominant IBS, or functional constipation. Among the 151 participants who were analysed, those who received oral aloe vera extract for the irritable bowel syndrome had a significant improvement in their symptoms when compared with a placebo. However, ingesting aloe latex can cause abdominal cramps, diarrhea, potassium deficiency, and kidney damage if taken improperly. Aloe latex is the part of the aloe vera plant suggested to have the laxative properties. Past research notes that the aloe vera gel does not have the same laxative effects, as it lacks the anthraquinones. The FDA ordered manufacturers to remove the aloe vera over-the-counter laxative products over the safety concerns. For more information about herbs, supplements, or health conditions, check out my website.